This is Rick Adam, Chief Executive Officer and founder of Recondo Technology, and we are very appreciative of your interest in the company and looking at our corporate overview. Recondo recently has had several awards which we're very proud of. We've been on the Inc. 500 list, the Deloitte and Touche Technology Fast 500, where our growth rate put us 9th out of 500. And very recently, we're extremely proud to get on the Healthcare Informatics Top 100, where we are on the list for the first time at 97 out of 100. At this point, I'd like to share a little with you about the state of the healthcare revenue cycle in the United States. And this material was derived from McKinsey & Company, but there are many other sources that come to very similar or the same conclusion. Our payment system in U.S. healthcare remains highly fragmented and inefficient, and it consumes a very disproportionate share of dollars compared with payment systems in other industries. Innovative solutions in healthcare have failed to take hold at scale, and consumer bad debt continues to rise, resulting in more than $65 billion per year in uncollected revenues, which is a 2010 number, and is probably much higher now in 2013. And according to our latest estimates, it put enormous strain on provider economics. The volume and complexity of healthcare transactions are rapidly expanding. Resulting in part from the system-wide complexity, health industry administrative costs will grow by about 10% annually over the coming years. We say higher, but actually much higher than the growth rate of medical inflation. The pressure to manage costs should increase the willingness of industry participants to work together and to try new approaches. And as you'll see through the rest of the Recondo presentation, what Recondo is trying to do is to get providers, hospitals and physicians, payers, both government and commercial, and patients to all work together to improve the overall efficiency of the healthcare revenue cycle. Recondo's objective is to streamline the U.S. healthcare payment system by, 1, improving information interchange between providers and payers. Secondly, having a software and architectural approach where we can dynamically apply the latest business practices and business rules among the parties. And finally, increasing the automatic processing rate by reducing administrative and frustrating manual steps. In the end, having a result that leads to prompt and proper payments for care provided. Recondo's mission is to improve healthcare in the United States and to improve the efficiency of healthcare providers and payers. And when a provider cares for the patient, we would like to enable making sure that once you've cared for the patient, you're promptly and properly paid after that care is delivered. From a corporate overview, we're 7 years old. Recondo connects providers, payers, and patients using breakthrough cloud computing solutions throughout the healthcare revenue cycle. Recondo software services are designed to ensure proper payments across the continuum of U.S. healthcare. Recondo brings efficiencies and cost savings to healthcare payment processing, which currently costs the U.S. healthcare system a staggering $460 billion in annual expense. Recondo helps hospitals streamline the revenue cycle by moving operations up front, up into patient access, scheduling registration, and therefore reducing manual intervention and delivering operational and financial benefits. Recondo combines a very sophisticated rules architecture and legacy integration and data mining from the payers to provide true interoperability for more than 450 U.S. hospitals. And currently, Recondo has a staff of over 250 staff members with deep healthcare expertise and strong technology skills, and we have invested more than $20 million in software research and development to make the revenue cycle more efficient. I'm now looking at a slide which shows a sample of our client base between our 400 to 500 hospitals. We really cover the spectrum, East Coast to West Coast, North to South. We have small rural hospitals. We have independent community hospitals. We have over 20 university teaching hospitals, several children's hospitals, and some large systems like Baylor and LifePoint. So we believe that our services can provide empowerment to getting paid properly and promptly throughout the whole range of healthcare providers. I'd like to spend a minute discussing revenue leakage. As providers provide care to patients, there's a potential revenue that you could receive if you're properly paid. Unfortunately, in the industry, it's very easy to miss a rule or not see a new rule or have your software not be up to date with the latest business rules, by which you're going to be paid by the government, the federal government or the state or your commercial payer. And so leaks like patient financial responsibility, medical necessity, eligibility denials, commercial authorization denials, underpayments, and lost charges result in much less net revenue than your potential revenue. So Recondo is trying to bring cloud-based software solutions in each of these areas that once you provide care to the patient, afterwards you're paid. This data is from the advisory board, and you can see a little bit of a shift from when they surveyed their clients in 2008 to when they resurveyed their clients again in 2011, which is the right-hand pie chart. And you can see issues or errors or mistakes that occur up in the front end of the system, up in the patient access area, registration or scheduling or pre-certification, where the end result is you've cared for the patient, but you don't get paid. If you look at the right-hand side, 30% of the time, even though almost everyone has an eligibility solution, you're denied because the person registering didn't quite understand the nuance of the patient's coverage. 24% of the time, hospitals get denied because they don't follow the commercial authorization rules or the pre-auth rules. And 30% of the time they're denied because they don't meet Medicare medical necessity rules. Recondo currently has solutions in the market used by our current client hospitals that prevent these type of denials in all of these pie chart areas. And this is a current lineup of Recondo's product line or service line. Eligibility Plus is a very highly formatted and enriched patient eligibility solution. It has extensive alerts to let our clients know that something is being processed where you may have the possibility of not getting paid, and significantly raises the probability that the patient's properly registered and we understand what their benefits are, and that once you've cared for them, you'll be paid afterward. Our authorization denial prevention software detects at registration or scheduling that a patient requires a pre-authorization for the combination of diagnostic code and procedure code that the provider is planning to provide for the patient. It does real-time alerting and automatic processing of encounters that require pre-authorization. This has a huge potential to reduce denials for pre-authorization and increase net revenue for the hospital. Our SurePay Health service line calculates patient financial responsibility at the front end of the process. So once again, as we see the patient get registered or scheduled, Recondo has hundreds of real-time interfaces into our clients' registration and scheduling software. We detect that the patient's in a high-deductible health plan, look at the charge master the hospital provided us, look at the contract with each individual payer that was provided to us, and we essentially adjudicate the claim in real time and calculate the patient coinsurance percentage and put it in a patient-friendly bill that the hospital in real time is able to print and hand to the patient and ask for payment pre-service or at point of service. This has a huge impact on upfront collections, and we have many hospitals where their upfront collections jump by hundreds of thousands and sometimes millions of dollars. Our Claim Status Plus offering is very highly enriched claim status data. We do traditional electronic data interchange or EDI, but we also are able to mine very rich data from payer websites that have much more claim status data than the electronic data interchange does, and we're able to bring this back in an automated way for our clients. Our EHC offering is a full-up claims clearinghouse, and we're able to do full-service claims and remittances for our clients. The Recondo Financial Medical Record is a relational database data warehouse with very extensive financial data stored from both the work that Recondo does and other files or databases the client may want to inload, and allows querying, reporting, and analytics for patient financial information. Our denial reporting software works off the Recondo Financial Medical Record and reports and does analytics to help manage accounts receivable and denials. And finally, our services offering, Trilogy, is a combination of insurance specialists, nurses, coders, and attorneys who help our clients get paid once they've been denied. So it's a success-based service where we secure payments from third parties, commercial insurance companies, Medicaid, Medicare, motor vehicle accidents, workman's comp, and overturn denials to get our clients paid. We're very proud of our service here. And in the clinical area, we have clients where we have a rescind rate where we successfully get them paid once they've been denied substantially over 90% of the time. I want to summarize Recondo's capabilities. So I've shared with you sort of what we do, and I'm just going to spend a minute telling you how we go about doing it. Our software engineers have built very comprehensive cloud-based software systems that benefit our clients, and they're platformed on rules architectures. So this is software that's dynamic and loads complex rules between providers and payers, and that allow us to keep very current with the latest business rules. So your contract changes, we automatically update. The payer changes the rules on eligibility, we automatically update. The payer changes the rules on pre-authorizations, we automatically update. So transactions that are handled by Recondo are up to date with the very latest business practices that occur between our provider clients and those folks that are paying them. Secondarily, we have very advanced techniques in electronic data interchange, where a lot of our EDI is context-based. We understand what question the client's trying to ask. We tailor the data to the client and to what that particular person in the business office or patient access is trying to solve for. We do extensive data mining from payer websites, and we reformat and allow the client to tailor exactly how they would like to see the data coming back to them, which has the potential to eliminate many manual steps and frustration on the client's part. Third, all Recondo solutions can run in batch, but they primarily run in real time, and we're real-time interface to your existing legacy software. We have hundreds and hundreds of interfaces to Epic, McKesson, Meditech, Siemens, and many other HIS vendors, including current generation and multiple back generations. By interfacing to your existing HIS system, we're able to improve your efficiency, avoid double looking, avoid double keying, and once again make the hospital's operation much smoother, more seamless, and less manually frustrating. And finally, we bring a very rich, experienced service adjunct to our software where we can fill in for the customer with our Trilogy brand. And if you'd like us to work your denials for you, we can do that. If you'd like us to help you during a conversion, we can do that. And if you need us to call your patients or customers, we can do that for you. So we can also bring a service capability alongside our very rich technical capability. I'd like to make the point that we've tried to serve our clients as broadly as possible. And as the company's evolved and we brought out more and more products, we've evolved from the pre-service area where we started out in patient access with Eligibility Plus and registration quality into patient financial management with our SurePay Health, which does patient financial responsibility, an e-cash sharing system that handles credit card payments automatically, and financial assistance, which helps detect patients that are either eligible for Medicaid or eligible for charity. Our authorization management service, where we status authorizations, we submit authorizations, we can handle the 278 automatic notification of admission that some payers use. We can manage the referral process from physicians into the hospital, and we can do Medicare medical necessity and also commercial medical necessity. More recently, we've brought out services that facilitate post-service or the business office, and there we have denials and appeal management, AR integrity, and system conversion staffing from our Trilogy group. And on the software side, we have the Recondo Financial Medical Record, our claims clearing capability with intelligent EDI, our Claims Status Plus product, denial reporting, and denial management. So we believe that Recondo can offer benefits to our clients throughout the entire revenue cycle, from the pre-service front to the post-service back. So we talk about Recondo as really across the entire revenue cycle. That's my presentation. We are very appreciative of your listening in, and we hope we've generated some interest. Please look at the rest of our website, where we have a very rich description of our various service lines, and we look forward to hearing from you soon. Thank you, and again, this is Rick Adam, founder and chief executive of Recondo.